Hello, hello. I am Dr. Bree. I'm a doctor of physical therapy and I specialize in pelvic health. And I work with everybody, all genders, all people, all ages. But the last couple of videos I filmed are about perimenopause. So they are for women who are that age range of perimenopause, which is that time, which can be anywhere from 5 to 10 years or even a little longer, that leads up to menopause. And menopause is the day that you haven't had a period for 12 months. That is the day of menopause. After that day of menopause, you are postmenopausal. But all of that time leading up to that day where you haven't had a period in 12 months is considered perimenopause. And it is a time of extreme hormone fluctuations and a lot of different changes in the body that a lot of women experience as difficult and challenging. And I just had my 44th birthday, and so I definitely am in the thick of perimenopause. I've actually been in perimenopause for at least 5 years that I know of, maybe longer. And I am really, like I said, in it. So I know what I'm talking about here. And I'm not an expert on hormone health. I'm an expert on pelvic health, but not necessarily, endocrinology and the science of hormones. But I have a personal interest in it, and I have some tips for you about perimenopause today. And specifically, I want to also point to the workouts that I just filmed for YouTube. So I have 2 workouts for YouTube that are going to be available by the time I post this video. So the first one is my personal flat belly routine for perimenopause. And it's a total core workout that's a little bit lengthier, and it's also a little bit more advanced. So it might be too much for some folks who are just getting started with core workouts and who are just building up their core strength. So because of that, I have a shorter workout that's more for beginners. And that is also one that I'll put a link to in the video description. So check out those 2 workouts if you're feeling the need to have some workouts that are really targeting your pelvic floor and your deep abdominals and your back muscles and these hip muscles. Strength and mobility, which is so important as we get older to help maintain our continence, our sexual health, our bladder and our bowel health, and also just our balance and our support system. Because as we get older, we really need that strong core to help keep our back pain-free, or at least pain low, and our hips from being too stiff and painful. We need to have a strong core. And your core is more than just your abdominal muscles. It also includes your pelvic floor, your back, your hips, your breathing diaphragm, all of this. And so the workouts I show are helpful for total core fitness. Now, some additional tips that I have for you about perimenopause. And just to share with you, some symptoms of perimenopause can include things like bloating, changes in sleep, changes in your energy level, mood swings, weight gain. It can feel like everything is just kind of getting thicker and heavier and kind of spreading in the middle of the body. There can be, again, bloating or digestive changes, a decline in libido, maybe a decline in motivation or your drive, kind of your motivation or drive for life in general, a decrease in stamina. And I know that I've really felt that decrease in stamina when exercising. I've always been a big exerciser, but for me, I just get tired more quickly. I love going dancing, and sometimes with my ecstatic dance sessions that I go to that are about an hour and a half long, I'm just done at about 30 minutes or 45 minutes, whereas before I could dance all night and be fine. So all of these are changes and more. There's definitely more than what I just listed. And it's different for everybody. Not everyone will experience these changes. And some people will experience entirely different changes, such as skin changes or even dry eyes and different changes in different parts of the body. But I'm just giving you a partial list so that you know that if you just know that something's off and something feels different than it did before, it may be related to perimenopausal hormone changes, and you're not crazy. I mean, that's the key right there, is you're not crazy. So there are things you can do to help. And I'm still learning. I will put a list of resources, some books that I recommend, some products I recommend. I mean, for me, one of my first hormones that declined was progesterone. And that's typical for most women. The first hormone that will decline quickly is progesterone. And so I'll also put a link to a cream that I use, a topical progesterone cream that's available over the counter. And it was one of the first things I used when I started going through my perimenopausal changes, and it really helped. But the key as you're going through perimenopause is to speak with a doctor and somebody who can test your hormone levels, or at least, even if they don't test your hormone levels, at least understand you and your symptoms and understand that, again, something's off and something needs to be addressed. And working with a healthcare provider who is really balanced in their way of thinking and takes into account your sleep, your nutrition, your stress levels is going to be really, really important, rather than just getting a few random hormone tests and calling it good. You want someone with a holistic approach who looks at hormone levels and who looks at all aspects of your life. Now let's talk about some tips for perimenopause. The first one is to keep exercising, keep moving, even if your body's starting to feel like it's changing, even if you're starting to feel heavier, maybe less energy, maybe you're starting to feel stiffer in the mornings, more aches and pains, things like that. It is to keep exercising. And I want you to exercise and do workouts such as my core workouts that I was talking about earlier, not to lose weight or to get your flat belly back that you had when you were 16 years old or 15 years old. It's not about that. It's to do it because it feels good to be strong. That is why we're doing it. Because let's face it, our bodies will change over time. And it's not to say that you have to just accept the weight gain and things like that. There are still things you can do to help manage your weight and manage your body composition. But I do think that it's really important to just acknowledge that our bodies will change. That's just the reality of it. And rather than doing our exercises for vanity or to maintain some ideal weight that is seen in magazines that the supermodels have, that supermodels are generally like 15 or 16 years old anyway. They're really young. So we don't want to look like them anymore. Like, we've moved on. We are wise. We are like the queens. They're like the princesses. We're like the queens. Honor your wisdom and all that you've learned. It's not about looking like the 16-year-olds anymore. It is about feeling our best, managing our weight for health reasons, trying to maintain our body composition for health reasons, and to exercise so that we are strong and fit, so that we don't have the back pain, so that we can pick up our grandkids when that day comes, if we ever have grandkids, or we can pick up our dogs and cats into old age. So we exercise because it feels good to be strong. And we exercise because it brings us joy and it brings us those endorphins, that endorphin hit that makes us feel good. It's not about looking a certain way, it's about feeling a certain way. And that's wise right there. And it's true that with age comes wisdom. Now, more tips about exercise. More isn't always better, and longer isn't always better. So it's true that exercise is a stress on the body. It's a positive stress on the body. It's great to exercise and be fit, but it does increase our stress hormones. It can increase our stress hormones, especially when we're doing long, lengthy workouts that just kind of go on and on and on and on. Sometimes people call this chronic cardio, where you're on a treadmill or an elliptical for 45, 50, 60 minutes because you think that's going to help you lose the belly fat that's accumulating or the weight that's accumulating. And that doesn't always work that way. It can really actually elevate stress hormones and not necessarily help you with weight loss. It can just kind of wear you out. So sometimes longer isn't necessarily better. And that's not to say that going for a long walk in the woods or a long hike with your friends is bad by any means. It's just that if you're doing 45-minute, hour-long cardio sessions every day, in the efforts of losing weight and you're just exhausting yourself and depleting yourself, it may actually be doing more harm than good. So you want to move your body every day. You want to get in cardio sessions, very important, but you don't want to deplete yourself. So if you're pushing past the point of feeling good with your workouts and you're just feeling exhausted every day and you're dragging yourself to these hour-long sessions on the treadmill at the gym, that's, again, doing more harm than good potentially. So you want to know that more is not always better, longer is not always better. When it comes to pelvic floor, especially if you're starting to experience bladder leakage or prolapse issues, which is very common, especially for women in the perimenopausal age range, studies show different numbers and percentages of people who deal with pelvic floor issues, but I've seen as high as 60 to 70% of women dealing with some type of pelvic floor issues at some point in their life. And so it's a really high number. And a lot of times people, when they start leaking urine or they start having trouble holding in their gas, or if they are experiencing pelvic organ prolapse, a heaviness in their pelvis, maybe they're told to go do a whole bunch of Kegels. So do 100 Kegels a day or something like that. Kegels are the tightening of the pelvic floor muscles, like you're stopping the flow of urine, that squeeze and lift of the pelvic floor. Now, Kegels aren't necessarily bad, but you don't need to do 100 a day. More is not always better. So again, less is so often more when it comes to exercise. Often stress management is actually key when it comes to weight management, getting enough sleep, managing our stress levels. Those can actually be way more important for our pelvic health and also for our weight than doing 500 Kegels a day and going on a 3-hour run. Sometimes it can actually be more beneficial for your body to do a session that's fairly short of weightlifting, because resistance training is really helpful and important for our bone density and our muscle mass as we get older. And I have some videos about safe resistance training for the pelvic floor that are on my YouTube channel. Of course, I'll link those in the notes below. But a 10-15 minute weightlifting session and maybe some yin yoga if you're feeling stressed out. Yin yoga is a very slow, calming yoga, wonderful for your flexibility of your joints and your tissues, and it's very relaxing. It can potentially help you sleep better and manage your stress levels, which is going to help with your overall hormone levels when you're managing that crazy cortisol that can get amped up when we're already perimenopausal and our hormones are all over the place, and we have teenagers at home and we have aging parents and we have life. Life is lifing and our hormones are all over the place. And so sometimes we need a quick walk around the block and a yin yoga session to manage our stress levels and ultimately manage our hormones and our weight. So it's not to say that running is bad or cardio is bad. Please hear that. It's just to understand that it's all about finding the balance that works for you and to make sure that you're getting some weight lifting, some resistance training into your life to keep your bone density up and your muscle mass strong, which is going to help keep your metabolism up, and also that you're getting some stress management in and you're not depleting yourself with excessive amounts of chronic cardio. Also, when it comes to exercise, don't just go through the motions of your exercises and just kind of do the workout to get it done. I really encourage you to drop into your body. Really feel yourself doing your exercises as you're doing them. Be present with yourself. That's called embodiment. That is embodiment, being in your body and not just up in your head or on the to-do list or thinking about tonight's dinner or thinking about the groceries you need to get. Being in your body is going to help you develop a relationship with your body and yourself, which is so, so important as we get older and as we're dealing with the stresses of our hormones being all over the place and the stresses of dealing with a life transition from our fertile years to our non-fertile years. It's a major life transition, not just in our physical body and our hormonal state, but in all the things that generally we are dealing with as people. You know, changes in income levels, or maybe you're moving to a new home. Maybe your kids are leaving home if you chose to have kids. Whatever it may be, there's going to be changes happening to you, career changes, marital status changes, family changes. So dropping into your body again and again and again, learning to know and trust your body is going to help you feel more comfortable and calm and trusting of your body so that you can make the best decisions for yourself, for your health, and for how to proceed, how to move forward when health things come up. Maybe you're gonna have a pelvic health issue come up, and instead of just going to the doctor and having the doctor say, oh, you need surgery, if you have a better relationship with your body, you can tune in and really ask yourself, is that true for me? Do I really need surgery, or do I want to try something else? When you have a trusting relationship with your body, you can have more conversations with your body. You can learn to tune into yourself and not just get kind of knocked around by what other people tell you to do when it comes to your body and your health. So it's not to say that what your doctor has to tell you is wrong by any means, but when you have that embodied relationship with yourself and more trust in yourself, it's like you are your own second opinion. And you can get opinions from experts in their fields, and you can listen to yourself too. It's really important that you are on your healthcare team and you're not just outsourcing to everyone around you. You need to in-source as well. And one way you can do that is by being in your body when you exercise, when you go for walks, when you do yoga. Rather than being up in your head, drop into your body. Breathe deeply. Slow the movements down. Remind yourself that you are in this present moment. Try to bring your thoughts back to the breath and the body rather than just spinning out into what's coming up next. Really, really key. And I talk about this in all of my programs, my courses. I do have an online course for prolapse relief. I have an online course for pelvic pain. And I have an online course called The Academy that's all about getting into the body. It's really a next step course. So if you want to look into any of my programs and courses, again, I will put the links in the resources below. When it comes to tuning into our body, as I was just talking about, I want you to know that another reason to really practice embodiment and getting to know and trust your body is that we can then see our symptoms as little love letters from our body. So any type of symptom we may have, whether it is a sore throat that's coming on, or pain in our shoulders, or tension in our pelvic floor, tightness in our pelvic floor, we can see them as little love letters from our body that's saying, something's going on. Something's going on that you might want to look at in your life. A lot of times when we start developing headaches or shoulder tension more and more, there may be reasons. There may be reasons such as a lot of stress in our life that's accumulating, and maybe these symptoms are actually just little love letters from our body saying, hold up. You've got a lot going on. You need to take care of yourself. You need to look out for yourself and not everybody else. You need to spend some time looking out for yourself as well. So just remember that tuning into your body helps you see your symptoms as signals and messages or love letters asking you to look out for yourself, not just random things that you need to necessarily run to the doctor for. And again, I want to make it really clear, I'm not anti-doctor. I'm not saying don't go to the doctor. Go to the doctor if you need assistance, but see your body as talking to you and sending you messages so that even when and if you go see a doctor, you also have this relationship with yourself that can help you tune into the messages and understand them a little better and interpret them with your doctor's advice rather than only taking advice that may or may not be true for you. So just to cap off this whole section on kind of movement and working out and embodiment, I really love, as I've already mentioned, weightlifting. I love Pilates for core strength. I love yoga for the movement, the stretching, the mobility, the flexibility. I love walking for cardio, and I love it also for the stress management. I walk because it makes me feel joyous and good. I don't walk to the point of depletion and exhaustion. I walk because it's a mood booster. I also love dance and other forms of non-linear movement. Movement that moves my upper body, my lower body, my hips. And this is something that is so powerful for staying feeling young, mobile, and flexible. You're only as healthy as your spine. And so keep moving your back, keep moving your hips. Even if it's a dance party all by yourself, so important to move in ways that are fluid, flowing, flexible, and fun. That's the most important part. Also important to get outside as much as you can. Fresh air is so healing. Now let's move on to talk about food. Food is so important when it comes to our pelvic health. Our digestive health and our pelvic health are very connected. So we need good nutrition to keep the bowels flowing smoothly and to avoid constipation as much as possible. The one thing I want to highlight is drinking plenty of water and herbal teas and hydrating yourself. Lots and lots of hydration. As we get older, our skin tends to get drier. We need hydration to keep the collagen that's in our tissues as plump as possible and hydrated as possible to prevent the drying that can be so uncomfortable in our skin. It can cause changes and can make the wrinkles look and feel worse. We want to plump our tissues up with hydration. So hydrate. And avoid the inflammatory foods like sugar. Sugar is there's not much that I'm like, blanket statement, everyone should avoid this, because everyone's different. And some people really need to avoid gluten, like I need to avoid gluten, but other people don't necessarily. But sugar, white refined sugar, is so inflammatory, and it literally causes, for me, bloating almost instantly, a feeling of heaviness and weight gain almost instantly, and I can see a difference in my skin almost instantly. So if there was one thing I would encourage everyone to do, it would be to cut out sugar. And unfortunately, alcohol really can act like a sugar in our body. A lot of us find that as we get older, women especially, tolerate alcohol much worse as we get older. So it just converts to sugar, and it can be something that our body doesn't process as effectively and efficiently as we get older. So I'm working on avoiding alcohol myself, but I still love a glass of wine, and I'm working on that one. But sugar, I have definitely cut back on so much over the years, and it has been a game changer. So cut down sugar, drink more water and hydrating herbal teas and electrolyte drinks that are healthy, not the ones that are full of artificial colors and flavors and weird things. We don't want those. So we want to avoid anything that's going to disrupt our delicate hormone balance anyway. The other thing is we want to avoid anything that's going to severely tax our liver. And that goes into that alcohol conversation that I just had too. Sugar, alcohol, all these things can tax our liver. And when we are getting older, we need our liver to be working better than ever. Our liver and our lymphatic system. These things, the lymphatic system and our liver, these are detoxifiers. And we need the lymphatic system and the liver to be working really well to help detoxify and get rid of excess hormones. Because even though you may think of perimenopause as a decline in hormones, because it is, things are changing, but we can have an excess of an imbalance of hormones where our progesterone tanks, and so our estrogen is all of a sudden like high relative to progesterone. And so our liver and our pathways of detoxification are going to help as we have these crazy imbalances and we're having excess of certain hormones and not enough of other hormones, and we have this crazy all over the place thing happening. Plus we have exogenous chemicals from our environment, like from plastics and things like that, that act as hormones in our body. So we need our liver to be able to filter all that excess junk out. Our lymphatic system and our liver, these detoxification pathways, We need them working well. Also, many of us have heard about bioidentical hormones or hormone therapy for a while. People were saying, don't do hormone therapy. But now it's starting to come back that hormones are actually potentially really great, especially bioidentical hormones for certain people. Again, I'm not an expert, but I will put resources and links in the notes, the description of this video, so you can learn more about the fact that hormones are back. Hormones are back, and many women are like, yes, I actually do need and want those hormones so that I can stabilize things and feel better. If, however, you are going to be taking these bioidentical hormones, you need your liver to be working really well and your lymph system to be working really well, because they're still external things that you're putting in your body, hormones that you're putting in your body, and you want to find that balance. So you need the detoxification pathways to be working so that you're making sure that you're not overloading yourself with too much of any hormone if you're starting to use hormone therapy. To help with our lymphatic system, we can do dry brushing, we can give ourselves massages as much as possible, always working up toward your heart. The other thing you can do is just move your body. Every time you're moving your body through exercise, you are helping your lymphatic system. Now for your liver, you want to really love your liver. You want to hydrate, you want to eat lots of broccoli. Broccoli is wonderful for our whole body, for our digestive system, and it can be helpful for our liver too. You want to think about abdominal massage, which can help the whole area of the digestive area and even the liver. Breathing is another thing you want to do, deep breathing exercises. Every time you breathe, your diaphragm moves up and down, the breathing diaphragm, which massages the liver and the digestive organs. So breathing deeply, massaging your belly, walking, moving your body daily, laughing, loving life, getting out anger, expressing your anger. Liver stores anger. We want to express when things make us mad rather than just bottling it up and holding it within. We want to express ourselves safely. You can check out my videos about release techniques, emotional release techniques through movement practices. I'll put some links in the notes below, and my Academy program talks a lot about that too. We don't just want to hold everything inside. Express, move the emotions through in a safe and gentle way so you're not just keeping it all in and trying to be the perfect woman. It doesn't work that way. We need to express ourselves. And that really comes to my last point here, which is as we get older, keep expressing yourself creatively. Creative expression is so important for your uterus. Even if you no longer have a uterus, if you've had a hysterectomy, you still have such power in your center and in your body for creativity, creation. The uterus, the ovaries, these are centers of creativity. We can create new life if we choose, if that's our path, to create a child and birth a baby. That is massive creation energy right there. But we also can feel this need that often as we get older and we lose our ability to, or desire, not ability, but we lose our desire or interest in playing and creating, we sometimes forget to be creative, to express ourselves. We can get so busy with life and bogged down with care of our families and all the things on our to-do list that we forget to play and express ourselves and create. And then we can get to the point where we don't even want to express ourselves in the way we dress. I discovered when I was getting ready to film these videos today, I thought, I had this knee-jerk reaction to say, don't wear shorts that are so small and tight. That's not appropriate for your age. I had that old story. It comes from my family, from other women in my family, and I had to check that, and I had to say, wait a minute, that's not who I want to be. I want to be that woman who is 70, 80, and if I want to wear hot teal-colored biker shorts when I'm 80 or 90 or whatever, I will. I don't want to let age define me and define the way I look, the way I dress, the way I express myself. I want to become more and more creative and expressive. I want to become more and more myself as I get older. And I think it's really important for everybody to take that to heart in a way that is meaningful for you. Because for you, it might not be about dressing in tiny teal-colored biker shorts. It might be something entirely different, but whether it's expressing and tending and creating something like a garden, or maybe it's tending to a hobby or an art project, or painting your nails, or wearing big jewelry. I've found that as I get older, I want to wear bigger, bolder jewelry. I want to. Don't blend in. I have a story from family members that say, as I get older, everything fades, my eyelashes fade, my skin fades, everything's fading. You don't have to. You don't have to fade. You don't have to fade away. You can continue to be bold and be big and be expressive in any way that feels good to you. So if that feels, I hope that feels empowering, let it be. Even though we're getting older, it doesn't mean that we are less important or less of a person. In fact, we're more of a person, because with every year we get wiser, we have more experience, and there is so much to continue to be excited about through perimenopause and menopause and all the way for the rest of our lives. Yes, we're gonna get older. Yes, we're gonna die. But until then, until that last breath, we can still live our best life for the stage we're at. We can still express ourselves as powerfully as we can for the stage and level of health we're at. It's not just about quantity of life, it's about quality of life. And so much of that quality of life comes with being yourself and expressing yourself in any way that feels good to you. So I hope this has given you some ideas for moving through perimenopause with grace. And I'm still figuring it out. I mean, I'm only 44. I know that's a baby in many people's eyes. So I'm still learning. I will always be evolving. And I humbly say that there's so much I don't know. But thank you for watching this. And definitely check the notes below this video if you want resources and links to specific products and books and programs that I have found helpful. And there will also be more ways that you can work with me in the programs and courses that I have online for people with pelvic health challenges. Thank you again, and we will see you in the next video.